Right, so welcome to season 2, episode 15 of Me and ADHD podcast. Today we are talking about the role of the NHS GP within our ADHD journey. And joining me today to give some insight into what is actually expected from our GPs is NHS GP Dr. Helen Wall. Hello.
Hi, thanks for having me here.
Thanks for being here. Um, the reason for the conversation, I guess, is because I've seen so many comments on social media, and of course my own sort of encounters regarding GPs, and it's like we get a lot of GPs refusing to do certain things when we think that they should do it, and it kind of got me thinking about, well, do we actually know what involvement the GP is allowed to have? Because you guys aren't specialists, obviously,
Yeah,
with this. Um, and it's kind of like, okay, so what can they do, what can't they do? um I think there's a lot of a lot of people kind of expecting the GP to be able to do and know everything.
yeah,
Like I said, you're not specialists and all that, and I think one of the problems that we have, especially as late diagnosed ADHDers, and I'll throw send parents in there as well, that we live in a world that everyone we speak to doesn't believe us, um, or they tell us we have to speak to people, and those people who we were meant to talk to don't really know about the situation, and then
yeah,
we get told that we have to speak to these certain people, and they don't know about the situation, but then they pretend to know and then give us advice that clearly is not kind of anything to do with us, and shows a lack of knowledge. So it's kind of like, okay, so where do we go? We don't know who to speak to. We don't know who to trust, and we kind of like go back to the GP because the GP is always there. Many of us have sort of grown up with the same GP and things like that, and then we expect the GP to know everything and to be able to do everything, which I know is not the case. So
yeah.
so here we are then. Here we are today. We're going to shed some light on what a GP does for us on this journey, what you're allowed to do, what you're not allowed to do, um, and uh, and yeah, hopefully that will please some people and hopefully rectify some misinformation out there as well.
Because I think it is a real issue for people with ADHD and for GPs. I think there's this mismatch in understanding. It causes a lot of upset, and I completely understand why. Totally.
Yeah, it's one of those things we've learned that the ADHD journey, even when it is going right, is still not set up for someone with ADHD. Because we have to read so much information, even fill in the forms. You have no clue how hard it is to actually read, understand what you've just read, remember, which is an issue of what you just read, and then answer the questions. And it can take such a long time. There's time constraints as well. So any part of the journey is not conducive to an ADHD brain. But hopefully, we can, start making things a little bit clearer for people, so people don't have to waste so much time and energy going down a route that actually they shouldn't be going down anyway.
Yeah,
So,
yeah.
so okay, so when it comes to, I guess the referrals, what are the ways a GP can refer for an ADHD assessment?
Well, I think one of the biggest problems that we have in the NHS general practice system is that every area up and down the country, and even different parts of the UK, the process will be different. The services available will be different. So there's no one size fits all GP practices in terms of what the referral process looks like. And that makes it really difficult both for GPs, but also for people accessing support about how to get referred in. And I get a lot of questions on my Instagram about how do I go about getting referred by my GP. essentially, local services are commissioned locally. So what is available to a GP in any particular area is very local, um, nuanced. There's no set program of what's available, and some areas have a local ADHD service that they can refer into, and some don't have a service at all, and that's a huge variation, and it's not right. It needs to change. Absolutely, it needs to change, but that is the reality of what we're dealing with. I think for me, it is difficult because we are expected as GPs, people, the person with menopause will come and say, you should be a specialist in menopause. The person with a skin condition will come and say, you should know everything about this skin condition. And, we are on a specialist register. Believe it or not, GPs are specialists, but we're specialists in being generalists, which is a bit explained to people. We know an awful lot about lots of bits, but we don't know a lot about one particular thing. A specialist will know the ins and outs of one particular condition or a few conditions, but GPs have to know a little bit about everything, and that's tricky. And a lot of our skill set is around communication, how to deal with risk and uncertainty, how to spot red flags in undifferentiated disease. So, people will turn up with absolutely anything, and we need to be able to pick out the sick people from the people that aren't as sick and those that need referring on and so on. So there's lots of skills that GPs have. But yeah, you're absolutely right. We're not specialists in every single area. And some of us will have done extra training on those certain things like ADHD, neurodivergence, menopause, etc. But that's very much into what people's particular interests are. And a lot of that extra specialist training has to be done in their own time, with their own expense, sort of, going on extra courses, etc. So I think, to go back to your original question, because I have gone off piece a little bit there, but your original question was, what's the GP's role in this referral? And for me, I think the biggest thing a GP can do and should be doing is listening and believing a patient. That is I train GPs. I've been a GP trainer for 10 years, and I can't train them to know everything about ADHD. I can't train them to be specialists in that, even though I have done some extra training in neurodivergence. But I hopefully can train them to believe the patient, listen to the patient, hear the patient's story and their journey. And that is the single biggest thing for me that I think a GP should be doing for a patient, because at the end of the day, as you've pointed out, we are that patient, often their contact point for their whole life
Yeah.
course, become their advocate in many situations. And, we would normally listen and look at the features and refer into a service, but unfortunately those services, as I said, aren't always readily available. And even areas that do have a service, as you'll know, there's a huge waiting time. It's really frustrating for everyone concerned. There's just not the services there to plug people into, unfortunately.
Oh yeah, it's crazy. It's crazy long. I mean, where I am at the moment, the adults, and obviously you've got the council for the children and the adult service. They've closed their waiting list. Been, I think, nearly a year now. It's been
Yeah.
closed.
We had a very similar situation in Bolton, where I'm a GP partner. We had probably 2 years, I think, with no adult ADHD service, and it was just catastrophic for people. And of course, we've got the other issue that even people who are on ADHD meds, who have been through that service, often can't access the medications because the GP won't take on that prescribing, which I'm sure you're going to ask me about.
Yep.
You Will your GP refer you? If you get referred and you get seen, you get medication or whatever, diagnosis, will your GP take that on board and run with it? And that's another big issue in this journey, isn't it?
It is. It's a huge one. I mean, I'll be the first person to put my hand up, and I've been lucky in many ways in my journey. I was in a good position. I could go private, so I got diagnosed privately, and I had shared care. I've still got shared care,
Right.
which has been great. Um, but yeah, there are, and I know GPs don't have to take on shared care.
Yeah.
Um, Again, I don't know why that's you can or you don't have to. But
Okay.
what is seems to be and more of an issue now is that a lot of GPs, and I don't know if it's your own decision or if there's I don't know, a regional hub that says, right, okay, this is what we're going to do, this is what we're not going to do. I have no idea, but they're starting to not do it.
Yeah.
I mean, I know last year, just as I was changing my meds, so I was just changing my meds. I was going through titration again, sort of paying for that, and then I heard that this, my GP was a surgery, all in the Thames Valley area, but my GP was surgery that was not going to be doing that anymore, and I
Mhm.
freaked because my medication is for like £460 a month for this
Yeah.
new one. I'm like, okay. But luckily it was all okay for me because they're keeping on the existing ones.
Right. Yeah.
But why would they stop? Is there a one reason or is there multiple
Yeah.
reasons?
Like many things in life, there's multifactorial, I think. And I think the first thing I need to point out that not a lot of people know is that GP practices are essentially independent businesses. So we are run as a partnership usually. We are a group of usually partners, GP partners, doctors who run the business but with an NHS contract. So unlike the rest of the NHS where you go to work, you do your work, you get paid, you go home. In a GP practice, you have to make the books meet, you have to balance the finances at the end of the month to pay your staff, to pay your building, to pay your rent, your bills, etc. And there's a lot of decisions that have to go into that. As well as being a doctor, you've got to run a business essentially. And therefore, we have a standard NHS contract, and that contract sets out everything that we have to do to be within the contract. But things like shared care are not part of that core contract. They're basically additional to that. So that means that each practice can decide for itself whether it has the capacity to do that, whether it wants to do that, whether it feels able or safe to do that, depending on the work, force that they have. And every practice will be different. That's why there's no two practices are the same. You can't go from one practice to the other and find that they've got the same way of making appointments, the same number of doctors, the same number of nurses. There's just no standardization in the sense of how a practice is run. Every single practice will be slightly different
Okay.
in terms of how it runs its paperwork, what kind of workforce it runs off, etc., because those decisions are made via the partnership. And they can make that decision as long as they are meeting the contractual obligations of the NHS contract. So when it comes to shared care arrangements, it's very much a practice decision, and it very much does feature in terms of how that practice is run, what the setup is, what kind of workforce they've got, what their expertise are or not, etc. I think more recently there will have been a change in practices that are agreeing to do shared care and are continuing with shared care arrangements, because you may or may not have heard of the call to action for GPs, which the collective action, as it's called. So, there's been a lot of strikes going on in
Yeah.
hospitals with junior doctors, etc., and then consultants. And more recently, the BMA RCGP, the Royal College of General Practitioners, looked at GPs. We can't strike. We're not going to strike because we are self-employed independent practitioners kind of thing, but they've referred to what they call this collective action. So it's about only doing what you're contracted to do, because there's so much unpaid work going on, so much unpaid activity. So there's a lot of stuff being done by practices that is not within the contract and is an additional thing. And practices are struggling financially. So I know there'll be a lot of people listening to this saying, well, GPs get paid a load of money, they should just do it. It's not, they're all paid far too much anyway. Why aren't they just doing it? But actually, I think about 200 practices closed last year because they weren't financially viable. There's a lot of financial pressures within the primary care system. Practices are going under because they can't balance the books at the end of the month. They are getting to the point where when staff leave, so when salaried doctors leave, when nurses leave, they're not being replaced because they can't afford to do that. We've got a situation where GP trainees are coming out of training and not able to get a job, not because we don't need them, because we can't afford them. So, this collective action is a way of trying to say to the government, we can't keep doing more and more for free kind of
Yeah.
thing. And unfortunately, and it is really unfortunate because I really feel for patients in this position, um, unfortunately, some of the casualties of that will be people who are on things like shared care and are getting them refused. That'll be one reason why shared care is being knocked back. But I think it's important to say as well, this is not all about money. And I get this thrown at me a lot from patients, it's all about GPs shouldn't care about the money. It's not about the money. It's not all about money. The drugs that are being used, particularly the stimulant drugs for ADHD, are what we call red drugs. They're controlled drugs. They are very, very specialist drugs. When we take on a shared care for those medications, we need to be absolutely sure that it is going to be shared care. And what I mean by that is the consultant that's asking us to share that care, or the provider, so the company that are asking us to share that care, we have to have reassurance and assurance that they are going to meet their side of the shared care
Yeah.
agreement. And by that, usually it is, if there's a problem with this patient, if I'm worried about the patient spiraling, if I'm worried that the medication's having side effects, if I'm worried that the dosage isn't right, you'll see that patient back in a timely manner, because otherwise I'm taking full responsibility for that and I'm not trained or, in full knowledge or control of that
Yeah.
situation. So there'll be a huge mixture of why practices start, stop, refuse shared care agreements. Part of it will be because of workforce, part of it will be because of the collective action, not being contracted to do it, and a large part of it is concern around safety and sharing and taking the responsibility if they don't feel confident that the provider will share that care.
Okay. So with that in mind, then, when it comes to shared care,
Mm.
is there a standardized I guess structure of what happens? Because I only say this because I've heard lots of different things from the reasons why they're stopping shared care, and some of it doesn't make sense to me because I don't see that personally happening with me. I mean, I'm sure there's lots of things going on behind closed doors, obviously, but um, when I all I see is from my GP, I order the prescription, signs it off. That's it.
Mhm,
He has
mhm.
no involvement in my with me as a patient, so to speak. Everything else is done by the clinic. So it's kind of why is that an issue for?
So I think, difficult because I'm not your GP, and we all obviously we're all different. But from my point of view, I think if I'm signing a
Yeah,
prescription, responsibility for that prescription, so I have to be confident that everything's a-okay and the patient's safe. It sounds like you've got a really good setup and your provider is doing everything that they need to do. They're doing the monitoring, they're checking up on you, they're seeing you. Unfortunately, a lot of the experience by GPs is not of that ilk. We have had significant issues where we've struggled to get patients back in to be seen by the specialist, and we've felt quite abandoned by, here's the shared care, there's the patient, there's the drugs, and we're not going to support. It does happen, and I think, I'm not saying it happens all the time, but I think once it happens to a GP once or twice, they become very nervous about carrying on that uh, arrangement, and they become nervous about all providers who perhaps are really good like yours, but there's that sort of nervousness to jump into that situation again. So I think some GPs will have had their fingers burnt with it. Some will not have had their fingers burnt with it, but have heard of people that have had their fingers burnt with it and just not want to go there because, it's like anything. We're not a homogenous group of people. Some of us are more risk averse than others. Some of us are, quite forward thinking. Some of us are more reserved. I guess when you're not in the full knowledge of something and you've not got that specialist information, and it affects your confidence in being able to manage these things, and unfortunately sometimes patients fall short of that.
I find that surprising. I guess I shouldn't find it surprising, but I just presumed the way I was treated and way I'm still being treated with my clinic, that was the same across the board. That was just how it was. So when I hear
Yeah.
about these things and all these issues that are going on, I'm like, why are these issues happening? Because for me, it seems so easy in that respect. It's But that explains it. So
Well, that's my experience, and if you got 100 GPs on, you might have 100 different answers. I'm just giving you my sort of view on my experience from what I've seen and colleagues I've sort of spoken to. Um, I mean, you probably know more. You probably speak to a lot of people with ADHD and the experiences that they've had accessing referrals and medication, and I guess you sort of know from them whether that's your experience is a repeated one. I mean, don't forget we're in completely different parts of the
no,
country
no,
as well, which
absolutely, yeah.
may have an impact on that.
It's yeah. I mean, some of the things that I hear about, even things like starting their titration. If they're on right to choose, and we'll go on it in a minute, and they've gone, they've had their assessment, and then they're waiting for another 9, 10 months for the titration to start.
Yeah.
I don't. Again, that didn't. I don't get it. 2 weeks. 2 weeks for me. That's not.
Amazing. You've got like amazing provider experience. I wish like every patient could have your experience because, I think I think it's sometimes feels to people and to patients, and I completely get this, that GPs just don't care. And, there will be obviously there'll be a lot there's always people that don't care about any particular given situation. But personally, I do really care. I want patients to get the help they need. I don't want them to suffer and have to come back and be fighting for care and to live, their best life. But yeah, sometimes the service, we're just up against a rock and a hard place, and we don't feel like the services are there to support us. And as the GP, someone once said to me, being a GP is a really hard job because it's you're the only doctor that can't discharge people. you know,
Yeah.
We can't say, if a patient goes, we refer a patient off to hospital or they go to A&E or whatever, and they say, oh, go back to your GP about that. We are that person, we are the person that person will keep coming back to. So we want to fix the problems. We don't just want to bin them off somewhere because they're just going to come back to us. It makes sense that we support them and we get them the right treatment. But unfortunately, it doesn't always work that way, and that's really, we get frustrated about that as well. And I guess some people are better at showing that in empathy, and some of it show it perhaps in disinterest. But I think, there's the GP world is full of lots of Mr. Fix-Its and Mrs. Fix-Its, and sometimes when people can't fix things, they appear dismissive or like they don't care because they just don't want to face the fact that they can't fix it. And yeah, and that's not great for patients. I know that.
It's no. I mean, what you're saying about up against it. I mean, it's true. And there's lots of things you said about what a GP does and how it works. I never knew about. And
Mm.
so this is what the conversation is all about. I'm sure there are people who do know, but I'm pretty confident there's a lot of people who don't know. I mean, I didn't know you were self-employed, you just have a contract and you run as a business, you know.
Yeah.
Um, but it's yeah, it's one of those really weird things that it seems to be, and it doesn't come from a GP sort of level. It comes from the government. It's getting worse, and literally nothing's being done about it. And if anything, they're allowing it to keep on getting worse.
I was thinking about this with regards because I run a menopause clinic twice a month, and I was there doing a menopause clinic. I come across a lot of people who say all GPs should be fully trained in this. It's not on, and I think what we need to remember is, in a way, GPs are being scapegoated for the fact that there are not these specialist services. It shouldn't be a fallback position that there's no ADHD service, so therefore the GP should be a specialist in ADHD. Equally with menopause, there's not enough menopause clinics, and there's nowhere near enough NHS menopause clinics. So why don't GPs know all about menopause, and why aren't they specialists in it? We're always the fallback position for filling gaps in services. And actually, we should be kicking off about the fact that there just aren't enough ADHD clinics around. There aren't enough ADHD specialists and, and menopause, etc., etc. But what often happens is it falls back onto why aren't GPs dealing with this? Why aren't they knowing about this? And I go back to my former point of, I don't think it's realistic to expect GPs to be specialists in everything. What it is realistic and what we should be expecting of GPs is that they are listening and believing of patients and understanding and supportive of patients. And I know that doesn't always happen.
I
Predominantly pressures on the system.
I think that is key. Again, going from a send parent aspect and a late diagnosed aspect, having someone listen to you and believing you and
Yeah,
showing empathy that's massive. It can make a
yeah,
difference, make a massive difference. I was on with our child. He had a bit of an issue the other week, and I had to call 111, and I spoke to the out of hours GP, and he said, "This is not really my specialty. I don't really know. I'm sorry, I can't help you." And I had to say to him, "So, no, that you telling me you don't know, that's massive. Okay, I totally respect that, because I've had enough of people winging it, and telling us a load of rubbish. And it's not, no, we don't want that. We don't want that. You don't know.
yeah.
Great. Let us know you don't know. And that's much respect. And I praised him for it. I said, really, thank you so much for telling me you don't know. And I needed him to know that it was okay.
Yeah, and I don't think you can underestimate the power of what you've done there, actually, because that is, that's one of the key things that I teach when I'm training the GP trainees, is about it's okay to not know. It's about saying, I can see this is really bad for you, and I believe you, I hear you, but I don't know when I can find someone that can, or I can, signpost you somewhere that can, because that is really, really powerful, I think, to patients, because yeah, I hear it time and time again, it's that not being believed, not feeling listened to, not feeling heard is so damaging, I think, when you're butting your head against a wall trying to get help.
Yeah, no, absolutely. Absolutely. And yeah, we just want people to believe. So I mean, yeah, we want the answers as well. That would
Yeah,
help.
that was,
So when it comes to referring them, do you,
yeah.
it someone says, okay, like, I think I have ADHD, these are some of my symptoms. Do
Hmm.
you, as GPs, do you go, right, okay, this is the sort of pre-assessment form kind of thing, we'll do this, we'll have a look, and then depending on what that says, I'll refer or not refer? Or is it completely up to you in how you know your patient?
Well, again, it will be GP specific, but I think generally speaking, it's about looking at why the person feels that they have ADHD, what they feel their issue, how it's affecting them. Most of that will be in line with a screening questionnaire, because that's what all the questions are. How what happens, how does it affect you, etc. It is up to the GP whether they refer on or not. We are supposed to do an assessment of whether we feel it's appropriate to refer into anything, whether that's ADHD services or whatever. But I think I would find it really difficult to not refer someone that came thinking they've got ADHD, because often people that attend to see us with query ADHD have done a lot of reading, a lot of research. It's rare that somebody comes up, and doesn't know the ins and outs of what they're thinking is going on here. Um, it, I've had a couple of patients who I can think of where I've said to them, "Do you think you might, have you heard of ADHD? Is it something?" And they've been like, "Oh, I've never even thought that might be a thing." But 99% of the time, people they walk in and they know they've got ADHD. It's about how we then access them getting a formal diagnosis. And I will often say to people, you're going to wait a while for this, but why don't you access some resources about ADHD, even if you're undiagnosed? If we are quite clear that you have significant features of ADHD, I think it's really helpful to start accessing resource support like ADHD UK, resources on there, and lots of other ones, Attitude, etc. Because There's things, that just knowing that support, and again, that belief from the GP, and signposting them to resources while they're waiting, because there's nothing worse than the GP saying, yeah, okay, yeah, I'll refer you, and you're probably going to wait 2 years, and then being sent away and having absolutely no, you're just being left in limbo then, aren't you, waiting for a diagnosis. So
Yeah.
I would start the process of getting them to think about what resources are out there and how they can access some support even before a formal diagnosis, really.
Yeah. Yeah, like you said, we tend to do a lot of research about it. Not to say that we're always right, but it's yeah, we don't walk through the door completely blind, to it. And a lot of
Yeah.
the time, it's because it's us, or because we've got a child that's been um, diagnosed, and then we're seeing it in ourselves as well, and things like that. Um, so so if you don't refer,
Mm.
and can the patient then get a second opinion?
Yeah, absolutely. I mean, with anything with a GP, you can ask to see another GP. It's not. People have what we call a named GP, but it's just something that we're asked to give people a named GP. It doesn't mean you can only see that one GP. If if you go to the GP for any condition and you feel that you've not been heard, you've not been listened to, your concerns haven't been taken on board, then by all means you should come out and ask to have an appointment with a different GP. And that does happen for all different conditions. I mean, obviously, if you are repeatedly going to the GP and everything you go with, you're having to come out and find a second opinion, then, you start questioning whether it is indeed a GP issue, or some kind of personal differential. But for certain things, if you are not happy, then I would not be alarmed at all about a patient asking for somebody else to see them for the same thing. I think that's a very sensible thing to do, because sometimes you just don't feel able to gel with a certain GP. Sometimes you don't feel able to be completely open with someone for whatever reason. You just don't click with that person, and you can't get your situation across. And I think we're only human. See somebody else, absolutely.
Yeah, it's like I had this conversation with someone the other day that even with therapy, even anything you deal with people, if you're not getting on with that person, you're not gelling with that person, or you're not getting the answers you were hoping for, you always ask for someone else anyway. So
Yeah.
it should be exactly the same. I think if you're asking for a second opinion, you should have, I guess, knowledge of what you're asking and some sort of proof of this is what's going on, as opposed to just stubbornness. Just you've got to have real reasons to understand, to think that you have ADHD. um okay, so we talked about the right to choose.
Mm.
um Now, I know, I think it's going to change a little bit, but I know there's, I think, about 6 or 7 clinics sort of signed up for it. So it's not all clinics; it's just they have to sign up for it. Um, with that, let's say there's 6 or 7 still. Is that kind of a bit of a postcode lottery if people are asked for that? Um, or is it a case of, it has to be someone they're close to you, right? So it's, out of those 6 or 7, you've got one clinic which is in your county. That's the only one you can go to, or is it?
Well, I think a lot of the clinics on there do online assessment. So, I think it's not necessarily a postcode thing. I think what is a postcode lottery is whether your GP is switched on to the right to choose ADHD situation, because I don't feel like that's been particularly explicitly discussed with us, or sort of been made aware of the situation. That sounds like a really rubbish excuse, but I speak to a lot of GPs and they say, "Oh, right to choose, what is that? What does that mean?" Which sounds bonkers, because we should be all over it. But I've done a few posts now on my Instagram about this, because a lot of patients don't know about it, but actually a lot of healthcare professionals don't know about it either. And what it basically is, if you may have a local service, your GP may say to you, "Look, I can refer you to this ADHD clinic, but the waiting time's 2 years," for example. And I've heard some people on my Instagram say the waiting time's near like 5 years in some areas, and that's huge. Um, But what you can do then as a patient is you could go to you could look up which providers are on the right to choose pathway for ADHD. So you can either Google right to choose pathway and all the different providers will come up. I think if you go on the first page of ADHD UK and scroll right down, all the providers are there. And there's a really good table on that first page of the ADHD UK, and it tells you, does this provider do child assessments or adult assessments? What's their general waiting time? How do you refer in, etc. And it's providers such as like Psychiatry UK, ADHD 360. There's a newish one come on board called ADHD Care ADHD, something like that. And they've got quite short waiting times. And I think, you can contact them. They usually have their own referral form on their website that you can get the GP to then complete and refer into. And a lot of patients get seen a lot quicker that way because a lot of them are online assessments, so you don't have to go in person. Now, obviously, there's pros and cons to that. It being an online assessment, that's not for, it doesn't suit everyone. But people have had patients that have been seen a lot quicker. I think the downside of it is sometimes those providers won't, they ask the GP to carry on the prescribing, and if the GP won't carry on the prescribing because they're not assured of that provider and they're not sort of confident with them, then you may be left high and dry because not all of those providers will carry on the prescribing for you. Although they are all NHS and it's not they're not private services, they've all got a contract with the NHS. So what I've heard a few of my colleagues doing is when they've referred into those services, those providers, they've actually said to them, we will not continue any prescriptions that you start. So if you are not willing to continue the prescription, please reject this referral. And that's a way of sort of heading off at the pass, because what they don't want is the patient to go along to that assessment, get a diagnosis, be started on medication, and then say the only way you can continue this medication is if your GP will continue to prescribe it. So I think some of them will continue to prescribe and some of them won't. So you just have to be a little bit cautious as to whether you're going to be left with a prescription at the end of it.
That's crazy. I
Yeah.
didn't know that was a thing either.
Yeah.
Wow. Okay.
That's what I've experienced with patients. So I think off the top of my head, I think, and please don't quote me on this, but you'd have to check, but I think Psychiatry UK will continue to prescribe for you if your GP won't take it over. A couple of the others won't from the outset, would say, your GP would have to carry on the prescription. So it's always worth checking, firstly, whether the provider is going to carry on the prescription if your GP won't. And if they say they won't carry on the prescription, will your GP before you even go for the assessment, because you don't want to be left
absolutely
high and dry with that. And of course, not everybody who goes for that assessment, even if you're diagnosed with ADHD, not everybody chooses to go on medication. I'm not saying that you have to go on medication because you've got ADHD. It's not for everyone. But if that's the thing that you're thinking of doing, then you have to sort of just be a little bit cautious about how you're going to continue any prescriptions that you get given.
That's mad. That surprises me. That surprise. Why would you? It doesn't make sense to go for an assessment and get a diagnosis with a place that's not going to keep prescribing you the medication that you need for that diagnosis. That's quite.
The numbers are so huge. I mean, I think I read one of the providers, I think they've got something like 60,000 people on a wait list waiting for assessment. For them to, what some of these providers are doing is sort of assessing, starting the prescriptions, and then asking the GP to carry it on, because just to keep that many people on a caseload for monthly prescriptions is a huge, amount of checks and work and so on. But obviously, every GP, as we've already discussed at length, every GP practice is different, and how they view whether they would be comfortable to continue those prescriptions is very individualised to the GP and the practice.
Okay. So, but technically, every clinic that's signed up for the shared care, and as long as they do, say, adult assessments,
the right to choose.
Yeah, the right to choose. They should be able to pick which one they want to go to.
Absolutely, yeah. And there shouldn't be any sort of your GP should be, if your GP agrees that you need to be referred for ADHD assessment, they should be fine with sending you to any of those providers because they're all NHS commissioned and they're all sort of on an NHS contract. Like I say, the issue will be then, your GP may not then want to take back that prescribing, and that's the kind of sticking point that you
Yeah.
need to clarify. And a lot of GPs are becoming savvy to this now, as I said, and when they refer the patient, they're actually saying, I wouldn't be prepared, or I would be prepared to carry on prescribing. So if this doesn't fit with how you operate, please let us know before you see the patient, and then they can pick another provider.
And that's good to know. No, that is good to know. My clinic seems to be the best ever. Uh,
Yeah, I don't
oh,
feel like you've won the lottery now, aren't you? Actually,
absolutely. It was honestly, it's one of those things when I start after I got diagnosed and everything, and I started looking at everybody else's, online and their experiences. I'm like, I don't understand why they've had these experiences.
yeah, it is a minefield, and I really, really, really do feel for patients because it's not their fault. It shouldn't be like this. It shouldn't be that just whichever clinic you get put into, it dictates. It's like whichever door you go through dictates the rest of your journey, doesn't
Yeah.
it? And you've not really got a choice which door you go through by and large. So it's really tricky for people.
Yes, it's yeah, it is, and frustrating
Mm.
to say the least. Um, okay, so we've gone through the shared care. Now, I was just thinking, when it comes to the shared care, just keeping on that, and you're prescribing a medication, and that's all going out nicely.
Yeah.
Um, is the GP meant to, technically, I guess, be involved with anything to do with that medication? Increasing it, decreasing it, stopping it, changing it. Have they got any involvement in that at all?
We wouldn't normally know, and that's the whole point of the shared care, really. So when we shared care agreement through, and it usually is an actual document that we're supposed to have, and it's supposed to very clearly detail in that shared care agreement what is expected of the GP and what is expected of the provider. So it might say something like, the GP is expected to give this many tablets at this dose every month, and every 6 months monitor blood pressure, weight, etc. And it may even give you the parameters. If blood pressure goes above this or below this, contact the clinic. And that is sort of the level of detail that we get, sort of very prescriptive. And then the clinic side of the agreement, because it is a shared care, so it should be both sharing that agreement. The clinic side would usually say something like, we agree to see the patient if the patient needs any dose changes, if the patient has any side effects or issues, or is unwell or deteriorates, we agree to see them in a timely fashion. And that would be a perfect shared care agreement, one which a lot of GPs feel more comfortable with and say, yeah, okay, I'm happy to take that on because it's very clear what my roles and responsibilities are. It's very clear that we're sharing this. It's very clear that the clinic are on board with joint responsibility for this patient. Unfortunately, some of the shared care agreements we get are very much like, I've seen this patient, I've started them on this medication, please carry on prescribing it. That's not really in the true sense of
Yeah.
the spirit. That's not a shared care agreement. That's just a handover of responsibility. And that's probably when GPs go, hang on a minute, this doesn't feel very shared and it doesn't feel very safe, and I'm not going to take that on because we are not, we're not trained or safe to be messing about with stimulant medication, which is a controlled drug, a red drug, very highly specialised. So, unless somebody's had specific training in that, which very few GPs will have, then it's not something that we would be generally wanting to start messing about
Yeah.
with.
Okay. Again, I asked that because I've seen some comments about certain things. Like, well, my GP doesn't do anything. My clinic does everything, monitors my blood pressure and everything like that. We have yearly sort of check-ins, but I contact them
Yeah.
anytime I want to. I send them an email with a couple of days later, email back if I've got any questions. If I have any questions about anything,
And if I was a GP in your area, I would take patients all day long on that kind of shared care agreement. That's perfect. I have no issue with that. You've clearly got brilliant access, timely review, annual review. They're doing all the checks. Perfect. I would have no issue whatsoever as a GP prescribing for that. Unfortunately, a lot of the shared care agreements we get are not in that vein, and that's where the problems come. And I think it's very unclear to patients. They hear the term shared care agreement and they get told, your GP just won't do it. But there's a lot behind that shared care agreement in what actually the difference in providers and what actually happens. And they're definitely not all like your situation,
Yeah,
unfortunately.
it is unfortunate. I mean, I just think they should be all just standardized. It should be the same. You should get the same assessment. You should get the same service. And it's like I've heard people getting assessed in like within an hour. Okay. I took 4 hours to go
Yeah,
through mine. And I just how can you do it in an hour or half an hour? Sometimes I've heard as well. I'm like, you should,
half an hour.
it shouldn't
Yeah.
it be all the same? But anyway, one more question about share care. I promise. Just last one. Um, with oh god, where's it?
Feel like we need a drum
I
roll now.
think we do. I think we do. Oh dear. I know I've lost it. I don't care anymore now. Okay. God, I got bored that quickly looking for it. Okay. Okay. Forget about share care now. We've done that to death. That's fine. But what I would like to know though, I think before we just finish up, to be honest, is someone comes to you or a GP. So look, I think I've got all these symptoms. I think it's ADHD. You do the pre screening checks and all that.
Yeah.
You go, yeah, it looks like it. We refer you. The waiting list is 20 years. That's
Yeah.
okay. Um, all right. So there's nothing else you can do on that side apart from stick them on this massive waiting list. But is there any therapies that you can refer, be it psychology, ADHD coaching, whatever it could be, speech and language therapy, whatever there is available? Can you refer without the diagnosis for the ADHD symptoms or
Well, I think again, it's going to be very area dependent and what's commissioned locally, so what services are available. I personally don't have access to any ADHD NHS resources, and I suspect that even people that do and GPs that do, these clinics normally have quite strict criteria, and I suspect having ADHD diagnosis would be one. So I think it is really difficult. When I've done stuff on my Instagram about ADHD and talked about it at length, I've had a lot of people come back and say, actually, the best thing I've ever done is even, above and beyond medication has been ADHD coaching and accessing an ADHD coach. And I find that really interesting because we don't have NHS access to that, certainly where I work. And I've started to sort of speak to a couple of these coaches, and I think the work that they're doing is really, it seems really quite life-changing for some
yeah,
people. And I think it's really good to have more of that, more availability of that, because I think we're in danger of perhaps putting it all on medication. And medication can be life changing. I've seen patients go from, life in tatters to absolutely smashing life with some medication for ADHD. But there's got to be so much more that we can do to support patients than just
yeah,
medication, because it doesn't work for everybody. They just don't want to go down that road.
yeah. No, it doesn't work for everybody, and some people don't want to do it. Some people have medical issues, high blood pressure, so they can't have them, or they just don't work for them. You know, my medication, I don't know why. Maybe it's because I'm quite large. My dosage is at the higher dose, so I've got nowhere to go except for just change medication. Um, so yeah, but medication is great. It has worked really, really well for me, but it doesn't do everything. You
No.
know,
Doesn't. And I think the other thing that we've perhaps not mentioned here that we perhaps should is, a lot of people self-medicate with alcohol and drugs, and they're looking for that dopamine hit because ADHD brains don't have enough dopamine often, and they're searching for that dopamine hit. They're overeating, gambling, shopping. I've got a couple of patients I can think of who've had real issues with spending money and inability to sort of control finances, and it's linked to that impulsivity and that sort of just dopamine seeking behavior, and it ruins lives. We need to think about how we can support people better to manage those things and not get to the point where they're having to self-medicate and spiraling.
No, absolutely. And I think this is where, if they can't get hold of the ADHD meds because of it doesn't work for them, or they haven't quite got the diagnosis yet, is that the therapies, the ADHD coaching and things like that will be invaluable. So if you are, as they say, you're dopamine searching and trying to calm your head through, the self-medication, they can point you in better directions to get that dopamine sort of hit. That's what they're there for. So
Yeah, so I would really like to, there's a lot of things I would like to see for ADHD care. One is, better timely access to specialist services, reducing the waiting times. But another one is a lot more packing support rather than just, straight to medication, or as well as medication, that sort of ADHD coaching, therapy support, and around that, I think would be really, really valuable.
yeah. I mean, I've had therapy before I got diagnosed, and I've been searching. I got referred for ADHD orientated CBT training, therapy, sorry. But they've come back, they don't do ADHD orientated in this area.
Mm.
So, but at least my GP referred me for it when I asked. So,
Yeah.
but yeah, I think it's key. I'm going for therapy, and I'm just speaking to someone now. Actually, one of my guests I had on, she's a psychotherapist and ADHD as well. So, so I'm, therapy is needed as well
Yeah.
for most
Yeah,
people, to be
definitely.
fair, but. But it is key. Medication is great, and it's changed my life. However, I still need more changing, which the medication won't do. So therapy is going to hopefully take me a little bit further. So
Yeah, well, good luck with it all.
thank
I
you.
hope it helps.
Thank you. And it helps. I mean, it helps when you've got people like yourself doing your thing online. And the reason why you're here is because I saw your posts and the questions about, you wanted some information about ADHD and everything, and I'm like, somebody's interested, and it's like, right, I want to tap into that, and it's, make use of that, so to speak.
Yeah, I mean, I came home from a clinic, and just sort of was thinking out loud on my Instagram about that. What kind of, because I was so frustrated. It was a particular patient that was really, really struggling, and I was scrapping around trying to think, what can I do to support this person? I can't get them into the clinic quick enough. What are these resources? And I sort of thought out loud without obviously mentioning the patient or any details. And the response I got was just like off the scale. And I have to say, I've been around a lot of different communities. I did some COVID vaccine work in COVID, and I've done some menopause stuff, and I've been on BBC, etc. I have to say, the ADHD community is probably the nicest bunch of people that I've had no, no nasty comments, no trolling. It's all just been really just amazing people, just really struggling to make sense of the world and trying to help each other. And it's been a whirlwind. It's been about a month ago that happened. It's been an absolute whirlwind of a month of just amazing people coming into my inbox all day long, just sort of asking, telling me, explaining ADHD, coaches, people with ADHD, undiagnosed people who think they've got ADHD. Yeah, it's been a brilliant month, really.
Yeah,
In that.
it's a growing industry. It's The community is fantastic. They're so supportive, and one of the reasons why I do the podcast is to speaking to people with ADHD. You're one of only, I think, two that hasn't had ADHD, and I've spoken to, and it's quite nerve wracking, to be honest with you. To be honest,
Right.
but when you're speaking with someone who gets it, who because it's their lived experience as well, it's so much easier to just let it all out. Um,
Yeah.
and even if they don't know you, they just accept, and they are such an accepting, sort of community, and they're brilliant. They're
Yeah.
brilliant.
No, not that. I felt it. I felt this sort of like, yeah, just this. They're just, but I can't even put it into words. It's been eye opening. It really has.
Yeah, that's good. Some of the people that's been on my podcast are podcast podcasters themselves. They do that, and there's no kind of, you know, oh, I want to get better guests than you or anything like that. Like I'm not going to go on your show because I'm doing my. No, it's like everyone's just together. They're just sharing it.
Yeah, it's brilliant. Brilliant. Wish the whole world was like
Yeah, no,
that.
absolutely. That would be better. Right. Thank you for coming on. It's been really, really nice to have you on. And to be fair, I was told I'm never going to have a GP coming on here. I'm like,
Oh,
yeah,
really?
go on now. Um,
Yeah.
but no, it's been brilliant. And what I'll do is I'll put your social media details on there as well, on the podcast, if that's okay. Just your Instagram so people can have a look.
Yeah.
And yeah, hopefully people get in contact and look at your content, because it is brilliant, to be fair. And it's worth, just not just for ADHD, it's for everything. It's worth looking at. So thank you again.
Look, and thanks for having me here. Like I say, it's been great. Just connecting with so many people with ADHD or thinking they've got ADHD, and I just hope that everybody manages to get the support that they need.
Yeah, no, absolutely. Brilliant. Guys, thanks for listening. And be good, be kind, and remember, you're not alone. Thank you.